Welcome back to the Healing Point Massage Therapy YouTube channel. Liana Bergonia, the owner of Healing Point Massage Therapy in St. Albert, has asked me to come back and talk about myths and misconceptions about massages. Hi everyone, my name is Alana, and thanks so much, Liana, for having me today.
Hi, yeah, thank you for coming here and to do this recording video about myths of massage therapy.
I'm really excited to learn the different myths about massages. Many people view massage as a luxurious spa treatment, but there's so much more to massage than just relaxation. From misunderstandings about its benefits and misconceptions about its appropriateness, we're here to clear up the facts and shed light on how massage can be a powerful tool for your health and well-being. So let's just jump right into it and tackle the first myth, shall we? Massage is only for relaxation and has no real health benefits. Is that true or is that false?
No, it's not true. So yeah, massage therapy is not just for relaxation. And every day when we see our clients, we always tell about the benefits of it if they actually do it, regularly. So the benefits of this massage therapy, especially for our mental health, is really, really important. Aside from the relaxing benefit, the tension release caused by everyday, stresses or job that we do, or relaxing the muscle by kneading the muscles, the tight muscles, massage has more benefits than we ever think. This includes pain relief, improved circulation, and stress reduction. It can also help with mental health and sleep.
Really?
Yeah.
Mental health and sleep.
Mm-hmm.
And how come?
Giving and massage therapy can give us those happy hormones for our body. So it's really help us relax and just our brain can go for a little vacation.
I love that. Yeah. So busted, massage is great for relaxation, but also real health benefits.
Exactly, Sa. And depression, I just wanted to also tackle about how depression is the leading cause of ill health and disability worldwide.
Wow.
So according to the latest estimates from WHO, more than 300 million people are now living with depression, an increase of more than 18% between 2005 and 2015.
Wow.
So, 10 years ago, that was our numbers. So I'm wondering what is the numbers right now, right? So yeah, it's really important that we take care of our well-being, our health and wellness. So yeah, massage therapy cannot just be thought of just relaxing, but more of the other health benefits it can do for us.
Wow, It has real health benefits.
Exactly.
That's exciting.
Yeah.
All right, and how about myth number 2, that massage therapy is painful? Is that true or is that a myth?
No, it's not true. So a lot of people are saying that no pain, no gain. So it's definitely not true. So the goal of massage is to relieve tension and promote relaxation at the end. While some discomfort is common during the massage, especially, some deep tissue techniques where we have to dig into the tissue and how it depends on how tight they are. It can be, there can be some discomfort while performing the massage, but should not be considered painful. So people have different pain tolerances, right? So that is why our massage therapist asks about the level of pressure all the time. As a client, we always also appreciate if you let your therapist know that the pressure is too much or not enough, especially if you're hurting and your body is tensing up and not relaxed at all. So we didn't want that to happen, because if you're tense, it's really hard for the therapist to do what they need to do to help you release those tense muscles.
Right.
Yeah. So it's about the communication, and yeah, so those things are really important. So yeah, it shouldn't be painful. It should be just enough for you to feel the release to your muscles. It's very common that after you can be in pain. That's also common. After your massage, you can be sore. So your massage therapist can be advising you about heat or anything, or take it easy, lots of water after the massage, because those are the what you needed to do after a treatment.
Great. Mm-hmm. So it is not supposed to be painful. And if it is, you should talk to your therapist
Exactly.
so that they can back off if it is painful.
Yes, yeah. So we
Great.
just go with what is kind of needing, like how much pressure you need, because you don't want it to be tensing up, because that's not going to be helping for you.
Yeah, that's going to be the opposite of what you need.
Exactly.
Great.
Yeah.
Well, how about myth number 3? Only people with injuries need massages. Is that true?
No. So, I'm still surprised by some clients that have never been to massage, and as an adult, and they finally come because their doctor have recommended, for a massage therapy due to stress or lower back pain or some type of injury. So I think the more we spread the word about about taking care of your body is very important, even getting massage to prevent injury, and not just because they have the present injury. So and then going back to only people need massage because they have current injury. So after an injury, actually, our body has to heal, right? So this creates scar tissue, and that massage treatment really going to be beneficial for that healing process, because massage can help the body to regenerate the tissue better and heal faster and heal properly. Yeah. So it's really needed. It's not just after the injury. So yeah.
Right. Mm-hmm. And is it true that regular massage therapy treatments can actually prevent injuries?
Yeah, exactly. So when you're going regularly to your massage therapy session, so your muscles and body are all, you have more range of motion, right? So you're not tight as always. So when you go for your run or you go for a big sport event, your muscles are healthy enough to, if you have an injury, you can bounce back real quick because your tissues are healthy. You have more range of motion. So it's not going to be, if you do have something happen to you, you can have a kind of a quicker healing process. Yeah.
Great.
Yeah.
I didn't know that. That's fantastic. Mm-hmm. Thanks so much. How about myth number 4? Deep tissue massage is the best massage for everyone. Is that true?
No, not everyone. It's not everyone's piece of cake. Is that how you said it? So yeah, not everyone also needs deep tissue. So I'm just gonna tell about the deep tissue. Deep tissue is a massage technique that mainly used, to treat musculoskeletal problems or issues such as strains or sports injuries. That's the one we use to do for that type of problems or issues. But it involves applying sustained pressure, so using slow, deep strokes to target the different layers of your muscles or tissue, such as the fascia, the tendon, and the ligaments, right? So this helps to break up scar tissue that forms following an injury and reduce tension in the muscle and the tissue around that. So everything that compensates after an injury or so. So not everyone needs that. Some people just kind of needs a relaxing one, right? So something that, so people that have generally healthier tissues won't need this type of treatment. So they can opt for some type of therapeutic massage where the therapist can work on the area where the tense are. Same, for example, your shoulders are really tense from working on the computer. So those things, so they can work on releasing the tension there without really digging in onto the tissue and fascia. But you still have the relaxing effect at the end, where a lot of more Swedish techniques where it's a lot more gentler. So yeah, so it really depends on what is needed for that session.
Excellent.
So, yeah. Mm-hmm.
And if a client doesn't know what they need, if it's deep tissue or relaxation, is that something that they can discuss with the therapist at the time of the treatment?
Yeah, exactly. So people usually call in and say, hey, I need a massage. So, and then we usually ask what type of massage you're looking for, to book today. And they would ask, if they have injury. So then definitely we do suggest some type of deep tissue, or it depends on what their goal for that day when they book in. Or some people really, they came in for some type of problem. But at the end, when they communicate with their therapist, they just wanted to work on that area. But at the end, they still wanted to have some relaxing treatment some relaxing techniques at the end. So it kind of depends on how did they say it to their therapist. Yeah.
Excellent. That's great to know, because I know a lot of people that are nervous to get a massage because they don't want the deep tissue, but they don't need to get the deep tissue.
Yeah, it's just when we need it. And sometimes clients come in like, hey, I just need a relaxing massage. Actually, this is very common. People just like, I just want a full body massage. And then the therapist will feel like how tense their shoulders are, and they don't even realize that, right? And they have to like, therapist will ask, can I work on this area? This will really benefit you if you can do some deep tissue techniques on your shoulders, and in the end, like, oh, I never had that type of, deep tissue technique treatments, and they realize they actually do need some of that. So again, it's really important that our therapist will tell them what they, what will benefit them too. So yeah, it's a lot more of knowledge. Just tell them the benefit of the treatment. Yeah, not just what they know what the massage is, or just kind of they just want to relax. But then those tense muscles are there. So it's really nice to just tell them, can we can work this out to really benefit and give you like relaxing feeling at the end. Yeah.
That's great. I don't think most of us know that we're very tense a lot of the time.
Exactly. Yeah. So.
Excellent. And how about myth number 5, that massages are a luxury, not a necessity? Is that a myth?
Yes. Yeah. So I think back then it was the case when people go for massage just for luxury, but that was then, not anymore, because a lot of studies show that what massages can do, right? So and also, did you know how many people are recommended to get a massage by their doctors?
A lot?
Yeah, so according to WHO, the percentage of doctors who recommended massage therapy rose from 50% back in 2014 to 62% in 2015. And I can't imagine what the numbers are, this year or in the next 10 years. So, yeah, I think many more people are finally getting the idea of what massage can do.
Doctors are finally recommending that it's a beneficial treatment.
Yes. Yeah, I'm excited for the future.
That's great.
Yeah.
What about myth number 6? All massages are the same. Is that true?
No. So like I said earlier about differentiating deep tissue from other type of massage, not all massages are the same. The first thing we ask when clients come in is, how can I help you today? Because everyone has a different goal when they come in. Some days you want just to relax. Some days are just like something came up, I have a kink in my neck today. I woke up with that. So, or, new injury, I sprained my ankle. So really, really depends. So, of what their goal for that day, right? So some days you just need to unwind, right? So, or you just need to get your back and neck tension, stressful week, so those things. So, it really depends. Not the same for every time.
What are all the different massage therapy treatments that your clinic offers?
Yeah, so deep tissue is very common. Mm-hmm. So, and then we have therapeutic massage where, so the deep tissue ones are kind of focused on working on tight muscle, strains if they have injury. So we do have the therapeutic massage where we can work on the area that needs to work on. Tension there, not as you won't feel as kind of deep going through the deep tissue layers of the muscle. So it's kind of more relaxing, kind of half releasing tension and half relaxing strokes. And then we have the relaxation massage where it's a Swedish massage where the strokes are more like long and kind of light strokes. But And then, so we also have like myofascial cupping massage where they use the silicone cups to help with the fascia, to release fascia. So that's also very common. And then we have the hot stone massage where the hot base of stones. Yeah. So actually even most of people get that on a cold winter, but even summertime, people still look for it because of how it's really good to have the stones actually being massaged on your, muscle, intense muscle. So it's not just for winter. So, and then, we do have a lot more different our therapists have a lot more trainings onto different things that they can look at on our website, because we have a lot more modality to offer.
Wonderful.
Yeah.
So there's many different types of massage.
Yes.
Excellent. Well, if you want to check that out, you can visit www.healingpointmassage.ca and look up the many different types of modalities that they have there. All right. And how about myth number 7? Massage therapists are not highly trained. Now, I know that's false, Leanna.
Yes.
Tell me about it.
So in Alberta, all registered massage therapists has 2,200 hour training to be able to practice here. So in addition to that, we have to get continuing education credits every 3 years. So to enhance your skills, maybe review, can forget things, right? So you can always come back to what you wanted to take courses again, or you want to get new skills or new trainings. So it's real nice that we have to do that, and just offer different modality.
That's great. Mm-hmm. So the continuing education piece can be learning new modalities?
Yes. Yeah.
That's great.
And it's really awesome because you can see different therapists have different wanting to go and dive into different type of therapy. So it's really good. You can kind of know yourself later on. Like, what do you want to focus on? So it's really nice that you have to do those things. Yeah.
That's great. Yeah. So 2,200 hours just to become accredited, and that's after you've done your schooling?
Yeah. Yeah.
Excellent.
2,200 hour training. Yeah.
And then ongoing education every 3 years.
Yes. Yeah.
That's fantastic. So clearly massage therapists are highly trained. Okay.
Yeah.
How about massage myth number 8? You should not receive a massage while pregnant. Is that a myth?
Yes, it's a myth. You have no idea how much pregnant mama are excited on their second trimester. You know why? Because they can finally get in for a massage. So we do recommend that at the 13 weeks to come in, because the first trimester can be higher risk for. So just to be on the safe side, we recommend them to come at the second trimester. So we do have a special bolster where like a big kind of area where they can lay on their face. So it's called prone position, where we can still massage their back while they're facing down with the bump.
Great. There's just a place for their belly to be.
Yeah, so some clients still prefer the side lying, where we just make sure you're comfortable with lots of pillows around you. But so we have kind of both options.
Great.
And and then it kind of depends on their preference, right? So benefits, if you just for everyone to know, so same benefits as what they get when they get the regular massages, right? So enhanced blood flow, relieve tension, and on the shoulders, neck, hips, especially lower back, and legs. So we all know that changes that happens while pregnant. So definitely helps our soon-to-be mamas to be more relaxed while being pregnant.
That's great. Yeah, that's fantastic. I always had heard that if you're pregnant, you should avoid them, but you just recommend that they wait until the second trimester.
Yeah.
That's great, because I know so many women become very uncomfortable in their bodies when they're pregnant.
Yeah.
So they should come on down to Healing Point for massage.
Yeah, and then we recommend every month till they're due. So yeah.
That's great. I love to know that. I'm going to recommend massage to all the expectant mothers I know.
Yeah.
All right, massage myth number 9. Massage can fix any physical problem in one session. Is that true?
No, not true. It's impossible to do that in one session. Same thing that sciatica did not happen overnight, right? So kind of the same thing. So, and it's also, I didn't like the word fix because we're not really fixing things and then we'll just think that it's not going to happen again.
Right.
So it's really important to know that therapy is just going to help you for that journey to be, to feel better, because you come in for a treatment, we help release those tensions. But if you don't do your assignment, your portion of those being well, it's also not going to benefit you. So, those stretching exercises, regular keeping your posture. So those little things, right? So if I just say, yeah, come fix me, but then you don't do anything after, so not true. So yeah, usually we try and get people, if you have something, right? So if there's something like acute or anything just kind of happen, come in weekly for, 3 to 4 sessions. Okay. And then the therapist can, reassess things and say, oh, maybe you can now do every month. So it's really important that you listen to the therapist, and because they know how, gonna benefit you in the long run. Yeah. So
great. I love that you called it a journey. Yeah. It's not fixing a body. It is a wellness journey.
Yes. Yeah.
And massage is just one piece of that wellness journey.
Exactly.
You still have to do your work.
Your part. And yeah, that's right.
Excellent. Well, thanks for letting me know about that one. And the last myth that we have is that massage therapy is the same no matter where you go. Is that true?
So for me, I believe every therapist has its own styles and techniques, that not everyone will like. Everyone has preferences. So, and every client has specific style in mind as well. So no one is better than anyone, than anyone else, right? So it's just need to match like what you need and what they offer. So I think communication is the key for this one, because when you book your appointment, definitely communicate what type of massage and level of pressure you need. So when you call in, book into the clinic, we usually ask those questions. And if you prefer someone to kind of get into your knots or trigger points, then we can recommend the people that love to do those treatments, right? And then people that just like more relaxation, and we have therapists that love to do a lot more relaxations or more prenatal, or more working with the mamas, or working a lot with young clients. So everyone is definitely different. But what is good about our therapists is that they can always suggest, depends on what you needed. So they can always modify things for the client. So
perfect. And how many therapists do you have at Healing Point Massage Therapy right now?
I think we're close to 20 right now, including our acupuncturists and manual osteopathic therapists. So
that's great. So there's a lot of different therapists you can try and see who fits your style best.
And also not just that too, there's also like what's your availability to, right? So we make sure that any time of the day, morning, evenings, or weekends, we can offer those times that so you can book whenever what's your preference.
Perfect. So you're open 7 days a week?
Yes, we are open 7 days a week. Wonderful. 9 to 9 p.m. on Monday to Friday, and 9 to 5 on Saturday, Sunday for now. But
excellent.
We'll get more hours as we get more people.
Great. Well, that's all of the myths that I have today, Liana. Thank you so much for sharing your expertise and your passion with us.
Thank you so much for this session today.
I look forward to learning more about massage therapy in upcoming videos.
Me too.
All right. Thanks, everyone.
Thank you.